So for me, there's not really a lot of direct treatments. Mostly it's treating like pain or concentration or, I don't know. I don't have any treatment for it except that I take some paracetamol or something that doesn't really help. But already a while there have been studies with LDN, let me see, low dose naltrexone, and normally that's for blocking opioids or something, so for drug dependencies. But that would be up to 100 milligrams. And for ME, they made studies with like 1.5 up to 4.5, so below 5. It's not, so it's really just a tiny dose. And it can help with pain and possible neuroinflammation, and because it increases the dopamine level in the brain, and it creates some happy and some energy, and it helps with the neurotransmitters. And often ME looks like it is something in the cell on tiny level where it doesn't produce the energy. And most people respond within the first 2 months, and it brings in the studies a 30% decline in symptoms already, and a significant increase of energy production in the cells. I don't know, they're going to have things how they measure that, but that sounds really good. It has a lot of interaction with other medications, especially opioids, obviously, so it needs to be monitored closely with the doctor, but because the dose is so little, on the other hand, it has very little side effects. So I'm going to my doctor with that idea again, because like 2 or 3 years ago, I only heard that's not proven. He's not so into experimenting like most of the doctors, but I said again now that there are more and more studies that this might help. And I'm hoping I'm getting a positive feedback from him, because I really want to try. And with it being such a little dose, I'm hoping to not have so many side effects. I'm very sensitive to side effects, and I had genetic testing for side effects for I having a very low metabolism. I have a video on that. So cross your fingers that that's something I can try. And I mean, that would be super if that could help.